right, there's the Alabama Jubilee by the Selden Scene, one of my all-time favorite groups, no doubt. I got so many though, I can't pick just one. But that's their version of the Alabama Jubilee. Let's see here. I have Jason in here with me from Modern Insurance, and we're going to talk to you a little bit about insurance. So many people say, but this is very interesting, and I know I went through this a few years back. Jason, how you doing, buddy?
Doing well. Appreciate you having me out here.
I appreciate you coming out and talking to our listeners a little bit about Medicare and so forth. You guys have Modern Insurance has 2 stores now. Is that correct? One in
So main location right now is in Bethel.
okay.
We had an office we were leasing in Milford.
Okay.
But we ended up acquiring a building in Bethel so we could have a firm location where they're year round. Though a lot of folks, if they've got through any of this with Medicare, they're used to, if there's an office, it's like people pop up and then they disappear for the year.
Right.
So we're there year round.
Let's get into that a little bit. It's some people get confused on Medicare plans and what's the best. And I know I went through it with my dad some years ago. There's plans that have a gap and all kinds of stuff. So why don't you just give us a little rundown on what people run into when they're looking for is Medicare or some other supplement or whatever the case may be.
Yep. No, definitely. I guess something that people get thrown into. Our main client is probably 64 years old, 64 and a half. You're starting to get bombarded with all kinds of information from every type of insurance carrier. Your phone's ringing off the hook. I mean, even if you're not Medicare age eligible, you're probably even get SAM calls. But we work with terms Medigap plans. People kind of heard of that before. It's the same as a Medicare supplement. And then we also help clients with Medicare Advantage plans. And we work with both. So our goal is to come from an education standpoint to give you an understanding of how Medicare functions and how it works first. And then based on your needs and healthcare and finances and things like that, we can map out a game plan ahead of time, whether that's we're going a supplement route, whether we go a Medicare Advantage plan and compare those options for you. So when you transition to Medicare, it's very smooth. We have an idea of what that is well ahead of the time that it's going to start, so you're not at the last minute trying to figure everything out. But the key is that we work with both.
Mm-hmm.
Okay. And the other thing with that is we help you compare those options and whether you utilize our service or if you try to figure everything out on your own, the cost to you is the same. So you might as well use an expert that's in this every single day. Yeah, I don't have to go to school and try and learn everything to figure it out.
Right. And it's confusing, especially, when you're trying to get into it. It's like, I had Medicare for a while and I wanted to get a supplement. So whatever Medicare didn't pay, they picked it up. Well, somehow they got me messed up and they got me a Medicare replacement. And I just now kind of got things straightened out from that. It's very confusing to people.
Yeah.
Sometimes.
Yeah, and a lot of times people will use terms interchangeably, which can get very confusing. So they'll say, hey, I have a Medicare supplement and not realize, like you said, a replacement or a Medicare Advantage plan, otherwise known as Part C of Medicare.
Mm-hmm.
So it's really, I've had plenty of clients that I've talked to that have been on Medicare for years, 70 years old, 75. I had a lady actually come into the office the other day, 77 years old. And she said, I'm on it, but I don't really know what I have. And
right.
Just because she just signed up because someone told her what to do when she started, but she never really had an understanding of what her coverage was.
Yeah.
Which in her case, she just happened to have been in the right plan. So it was good for her.
Right.
But it's really nice to know what you have. So that way you can understand what those options are on your plan, if there's any additional benefits, how to utilize those benefits, or even if you're doctors, if we need to look at networks and things.
Right, networks and so forth. That because I know sometimes your plan doesn't cover your primary physician, or whatever the case may be, and then there's plans that you pay really a lot of money when you have to go to specialist or hospital visits or whatever the case may be.
Yep.
And there's I know there's plans out there that help you, and you hear these things on TV about the part A and part B and C and D and so forth and so on, and it gets really confusing. People don't know, like you said, the lady just had a friend of mine come to us on Facebook, and we are Facebook Live for a while, folks, in case you want to tune us in, WOBOSM.com, and of course 88.7 FM in the greater Cincinnati, Northern Kentucky area. Jason, do you have certain areas that you're allowed to work in, or can you work anywhere? Do you have affiliates that you can, if somebody's out of your area? I know I was in Grant County, and I moved to King County, and the people in Grant County said, well, we can't renew your policy. You have to talk to an agent in King County.
Yep.
And which I did. Is that the same in Ohio?
So actually, me personally, I'm licensed in 17 states. My main focus is obviously Ohio. So anyone in any of the states that I happen to be licensed, I can actually assist through that. So any county in Ohio, I can help you with.
Okay.
We have proprietary software that allows us to look up all the plans that are in that area and quickly compare those options for you, so you don't have to call those 800 numbers for every single carrier and trying to figure it out. So,
all right, I'll turn him up a little bit. Said couldn't hardly hear you there for a second, so we'll turn you up a little bit to see what that does.
Try to get closer to the mic.
Right, I'm very far away. And there you go. We got you now. So I just had a friend of mine said, he said, this is a great time. And he said, I'm turning 64.
Okay.
And, so that's why I asked the question if there's an area that you're allowed. So with you're licensed in 17 states, and you can actually go on in any county in Ohio, and talk to them and let them know what's available in their area. You see, Kentucky's different, which you probably know. We're different. Is there a big difference in the different plans? I mean, as far as cost wise, is there a lot of difference between basic Medicare that we all get when we're 65, or some of the plans, or and in some cases, is it better to have Medicare and add a supplement to it, or is it better to have a replacement like they did me?
No, that's a great question. That's where we get down to the heart of the individual, because there's really not a one-size-fits-all, really. So that's where we dive into, okay, what are your specific needs? And is this the first time you're starting Medicare? That's always a good question.
Right.
Because there are some folks that, in certain situations, even if they're not 65, actually have started Medicare earlier. And we come across that as well. So we can assist folks that are in that, that fit into that bucket too. But the biggest thing to look at is you have standard Medicare, which everybody comes on to or is eligible at least at age 65. But that's also a conversation we have is, do you even need to start? Because that's a misnomer. A lot of times people think, oh, I'm 65, I have to take Medicare. That may not be the case, but you may need to. So we'll have that conversation. But you have a premium for original Medicare. And then beyond that, you'd have additional money that you would pay for your supplement, like you said. So we're going to pay to insure our insurability. Okay. And then the other option is, if you go that route of a replacement or a Medicare Advantage plan, many times in most people's area, those may come in at $0. So a lot of times people will look that direction because now I've got my health coverage. It's similar to what I'm used to when I was working, because I'm used to working and having a network with my coverage.
Right.
Which actually, what's new when you come to Medicare is the fact that if you only have original Medicare or you have original Medicare to supplement, is now you don't have a network. That's new. Most of us during our working years and with employer coverages or anything like that, we're used to, okay, my doctor's in network, I need to go see a specialist here. That's what we're actually familiar with. And so that's where we come in to dispel some of the rumors that come along with replacement or Part C is, well, actually, that's what we're kind of used to working with, right? And those will tend to also, Part C, those will typically include a dental plan, a vision plan, hearing as well. There may be some other benefits that go along with it. And because you're saving money premium-wise, you can then utilize those dollars to maybe fill in other gaps of your plan.
Right. Right. And am I correct in when you turn, say, when you start drawing your Social Security, they automatically take out X amount of dollars for your Medicare. Even if you get a replacement, they continue to take that out.
That's correct. Yeah. So regardless if you go to a Medicare supplement or you have a Medicare Advantage plan, you still pay your original premium for Medicare. Now, there are some plans that are out there. If you're someone that fits into that, they actually can give you money back to your Social Security, so it can actually reduce the cost of your Medicare. But again, that would be a discussion for an individual to see if they fit into that, because again, it's not a one-size-fits-all.
Right, right. Yeah, it's like we have discussed earlier. It's really confusing to a lot of folks, and like you said, some folks have Medicare. I know my dad had Medicare for years, and he ran into a guy, and the guy got talking to him about supplements, and he got talking to him about replacements, and he came out and sat down and talked to him about, what was best for him. And like you said, it's not really a one size fits all. It's what's best for you and your situation.
Yep. I mean, we'll even have couples, so husband and wife, on completely different plans. They may be with different companies with a Medicare Advantage, or even we may have one has a supplement and the other one decided to go the Advantage plan route.
Right.
So just based on their individual needs.
Wow.
Yeah.
Prescription costs.
Yeah.
Outrageous. And those, a lot of, they got me on I just had open heart surgery.
Yeah.
And they've got me on a shot. They need to help control my weight plus my sugar. And they've got me on this medicine. Some of you folks out there might have heard of it or know about it. Trulicity. And Medicare didn't pay very much of it at all. I mean, they're really, really, hardcore about it. And my replacement said, yeah, we'll do that. Just, have the doctor prescribe and so forth. And then I've got a friend of mine that's on it too, and every so often he has to go back and get them to renew, reevaluate that particular medicine. It's very expensive.
Yeah. I think the retail, I think it's around $600 or so retail about on that medication. And that's where it comes into, like you said, the drug coverage. So that's something else that's new when you come onto Medicare, is they separate the cost of your drugs from your health coverage. Okay. So that's why you have to have prescription drug coverage as well.
Right. And then they have like tiers.
Mm-hmm.
They have the three or four tiers.
Yeah. Depending on the company, you have tiers 1 through 4. Some companies go up to 6 different tiers.
Yeah.
But it's the way that they internally calculate their formularies and how they're going to spread the cost of those medications, and the way that they write that to be able to offset different costs. And sometimes they put a drug onto a tier 6 because the way that their formulary is written, it actually makes it a lower copay for you. So,
wow.
Yeah.
Do you recommend people to look into it before they get to that age, start looking ahead Or should they wait till 64 and start at 64 and a half? I mean, it hits you.
Well, no, that's a great question, because our conversations generally start between a year to 6 months ahead of time. Because if you decide to go the supplement route, you can actually lock those rates in 6 months prior to your 65th birthday. But that conversation is not bad to start anyway, because we look from a holistic standpoint. So Medicare, that's our main focus from an education standpoint, when people transition to that. But because we work with life insurance policies and working with people in wealth transfer and how they can help keep their money, right? That's always something we're looking at, retirement. And then also looking at if you have retirement funds and you're considering moving some of that money as we get older, we tend to want more of either a guaranteed return or safer money.
Right.
So we can look at those aspects as well. So even prior to starting your Medicare, we can kind of help map out a picture as far as what your goals are moving into retirement. And Medicare is one of those facets. So the conversation regarding Medicare, that typically starts about a year to 6 months ahead of your 65th birthday.
So there you go, folks. If you're 63 and a half, 64 years old, you need to start talking to someone about what's fixing to happen. Because, like I said, it can get pretty daggone confusing. And sometimes you have things, you think you have things that you really don't.
Yeah.
And you don't have it. Yeah. Sometimes you don't find out till you need it. Perfect example. I went down to Smoky Mountains with the family, and we get down there, and I took one of these really bad allergy attacks. Head stopped up, and I went to one of the urgent care places, and gave them my insurance card. This is when I found out I didn't have Medicare. Gave him my Medicare card, and the lady said, "Sir, you got another insurance card?" She said, "You don't have Medicare." And I'm like, "Huh?" And I said, "Well, I got a supplement." And she said, "Well, let me see your card." And that's when I found out that I had actually switched. Not knowing that I had switched, instead of a supplement, he actually put me on this guy put me on a replacement, a Medicare replacement. They took care of me, but I had no clue that I'd even be switched. I thought I still had Medicare and had the other as a supplement. And you don't want to do that. You don't want to be out there and think you have something and you don't. You're not even close.
Yeah, but it's a matter of really understanding what you have, right? Because like you said, they still took care of you. Even though you didn't have original Medicare, you had that Part C, right? So you elected to have a private insurer, become your primary payer. But the good news is they still took care of you.
Exactly.
So in your situation, that's I can't get coverage because I'm not at home.
Yeah.
And in your case, you did.
Yeah.
Right?
Yeah.
So,
but it does. And I guess the way that the lady explained it to me in Tennessee is I guess there are some people that actually go through that, that they think they're covered and they're not covered.
Yeah.
And here they got to suffer till they get back home. So you need to start thinking about some of that stuff and what's going on. How do we get a hold of you?
Yeah. So our office, again, we're out in Bethel. So you can walk in. I'm out there about 4 days a week. Today actually is the day that I'm typically not there. But someone is typically there 5 days a week, Monday through Friday. It's 424 West Plain Street in Bethel, Ohio, 45106. That's the address there. If you wanted to call us, even if you're local and you just want to make a call, you're welcome to do so. Direct line out there to the office, it's 513-466-0209. If you are local, I always just let people know, it will tell you that's a recorded line. Because we work with folks in Medicare, it's actually a requirement from Centers for Medicare and Medicaid that those calls are recorded. So that's why it'll tell you it's a recorded line, just in case anyone gets, did I dial the right number? So, but you can call that number, ask for me. Again, my name's Jason. Jason Gray is the last name, Gray, like the color. But yeah, be more than happy to help you through this. If you're still working, that's one of the things that we help folks with. Hey, I'm still working. Do I need Medicare? You still need to have that conversation, because depending on your situation, you may find Medicare is a better option for you, or you may want to stick to your employer coverage. We've been helping a lot of vets lately. Okay, so if you have VA benefits, you mainly see the VA for all of your coverage, and you have Medicare, there are some plans that are specifically tiered to those folks that can offer them some additional benefit or even help reduce the cost of their Medicare. Because at the end of the day, if Medicare's your backup plan and you're only going to the VA anyway, why don't we see if we can't find something that fits your needs as well and maybe gives you some money back to your Social Security to help reduce that cost?
Absolutely, yeah.
So definitely all of those conversations, if you are starting Medicare or are going to be eligible at age 65, it's a conversation we need to have. One big thing I keep coming across here lately, and it is confusing, because Social Security Administration, they handle your Social Security benefit, and they also handle Medicare. But those two things are completely separate from one another. So if you're not retiring, that doesn't mean you can't start Medicare, okay? So even if you're not collecting your Social Security benefit, you can still opt to get Medicare for your health coverage if it's a better option for you. All right, so that's one of the big things, because I'll have that conversation. I'm not retiring yet. I don't want to start Medicare. And what they really mean is, I don't want to retire. I don't want to get my Social Security benefit reduced because I'm still working. And that's fine. We don't have to start Social Security. We can just start Medicare for you if that's the right choice.
Okay. Just had, and I know you'll get a call from this guy. He would like for you to repeat the address and the phone number. And we have Debbie is online here. She says, good information. And gosh, it's overwhelming just to hear all this. Overload for me. And she's 63.
Okay.
So if you would, one more time, address, phone number. And John, get ready to take this down. And and tell your friends, Debbie, tell your friends, they're in the same shape that you are. They're 63, 64, so forth and so, and they can call and get the information that they may need. And so one more time, it's the Modern Insurance Store.
Yep. So the address is 424 West Plain Street, Bethel, Ohio, 45106. And then our line out there again is 513-466-0209.
And Jason, we want to thank you for coming out and being with us today. And for you listeners out there, we will be replaying this. We call this Community Spotlight. And I'd like to have you come back sometime. Yeah, kind of give us an update and, let people know what's out there. And I'm sure between now and then, they're going to call either you or someone, and they're going to find out that this stuff, like Debbie says here at Facebook Live, it's overwhelming just to hear some of this stuff. And it is. It's there's a lot to take in, a lot to consider when you're getting to that age to get Medicare. And as I said, I've been through it. I went through it with my dad. I went through it with my mom just recently. She switched from Medicare to another plan. And there's plans out there that definitely will save you money. There's plans out there that might cost a few dollars more, but you get so much more for that few dollars.
Yep.
And a lot of stuff to take into consideration. And again, we want to thank you so much, Jason, from the Modern Insurance Store. You can find them online. You can give them a call. And we will air this program again a few times, and in a month or so, we'll have Jason come back and see if there's any updates, any new things that's out there and that's happening. Like I said, you brought up some things where you're in it every day. You hear people's questions and what they need and so forth. We don't hear that. We, the general public, don't hear that, and we have no clue.
Yep.
Thank you so much. I appreciate you, my friend, and we'll get back to the music. You're listening to Wednesday Morning Bluegrass right here at WOBO 88.7 on your FM dial. We'll Facebook Live for just a little bit. I'll tell you what, I'm going to go away from Facebook, and I'll be back at the top of the hour, and that way I can talk to Jason a little bit off the air, and we will we'll air this program again. So y'all stick around, and we'll get back to the music right now.